Hi, Dennis. I'm really glad Jim gave me the opportunity to send some thoughts to you. Jim's asked the question, what have I learned from Dennis Klassen? Well, as you know, we've been colleagues for 18 years, but I am neither a minimally invasive surgeon nor one of your previous trainees, so some of my thoughts are maybe a little bit different from some of the other videos. I do recall, however, cajoling you to come to the operating room to teach me how to do a laparoscopic ventral hernia repair in one of my big incision patients. And we had a great day. I enjoyed it a lot, but unfortunately it didn't take. I do not share your skill or your passion for the procedure, but I do always think of you every time I'm muddling through one of these cases. And usually I'm only muddling through because I have a resident who you have taught how to do the procedure. I've learned from you outside the hospital as well. As you know, we play hockey together on Friday nights, and in the spirit of brutal, complete honesty, sometimes your shifts are a little long. 30 seconds, 2 minutes, 3 minutes, a little long. People on the bench waiting to come on, blah, blah, blah. You know the story. But what have I learned from you? You, in the dressing room, every time you pull out 6, 8, 10 obscure high-end European beers and pass them around. Everyone is happy. There is no ill will whatsoever. And now that I'm actually thinking about this, as you know, Ellesmere shares your proclivity for kind of extended shifts where you don't come back over the red line. He has an awful lot to learn from you. I hope he takes that to heart. More seriously, however, you know, I think that I'm convinced that residents need to see the full spectrum of surgeons to make decisions about who they really want to be as surgeons. And over the past 18 years, you've served that role as the patient teacher with exceptional surgical skill, who residents just really want to spend a day with. And they want to spend a day with you because you're interesting, but I also think they want to spend a day with you because you're interested in them. You spend a couple days with a resident, you come home, you come out of that knowing far more about them than many of us know over 5 years. Your departure in the division leaves a really massive gap. And I know that you have current and upcoming tough days physically, tough days medically, and tough days emotionally. And over the past 18 years, you've faced everything with kind of an understated strength and humility and dignity, and I have no doubt with what I've seen over the past several weeks that's going to characterize the next while. Anyways, Dennis, I wish you all the best. I look forward to another glass of wine coming up, and of course, with that glass of wine, you will choose.